is the term to describe all the systemic veins of our body. So the systemic veins, not the ones on the pulmonary circulation, but the systemic veins, they do carry deoxygenated blood. So all of this is moving deoxygenated blood from tissues back to the heart. So we're moving in the opposite direction, distal to proximal, okay? In the opposite direction, I meant from the arteries. Now, all of this deoxygenated blood is going to follow veins again, and they're going to open and empty all of this deoxygenated blood into the right atrium. The right atrium, remember, that receives blood from three veins, right? The superior vena cava that drains all the body superior to the diaphragm muscle, the inferior vena cava that drains all your body inferior to your diaphragm muscle, or a horizontal line through your nipple, and the third vein is the coronary sinus right there, which drains the heart itself. Okay, so in here, we can see, and I showed you this before, how the veins are opening into the right atrium. This is the coronary sinus, draining all the blood, deoxygenated blood from the heart, the inferior vena cava that we'll describe later. And let's now describe a little bit, or talk a little bit about the superior vena cava. Now, this superior vena cava, let's describe it. Okay. Let's see how it's formed. So here we have our beautiful heart with the 4 chambers, and this is your right atrium. This is where every deoxygenated blood is going to arrive. And we just said that in here opens the coronary sinus that drains the blood from the heart, the inferior vena cava that drains the blood inferior to your diaphragm muscle, but also is the superior vena cava that drains your blood from deoxygenated blood from the body region superior to the diaphragm. That's an ugly superior vena cava. Let's see. Okay, let me see if I can label this so we're kind of oriented. That's superior vena cava, okay? And that's a C. Superior vena cava, yes. Now, how do we form that superior vena cava? Let's use, green. Superior vena cava is formed by the junction of 2 veins. I'm going to put it something like that. Okay? And these veins are your left, because we're in the left thigh, left brachiocephalic vein. And this one is the right brachiocephalic vein, not trunk. Trunk is an artery. This is our veins. So right and left brachiocephalic veins. How do we form these veins now? Well, we have coming from your neck and also your, that's ugly, right? And this is kind of a gigantic neck, but coming from your neck and head, we have, these are the internal, this and this, that's okay, internal, jugular, well, that's in J, jugular vein, okay, this and this and this. And coming, let's use this one, it's not red, coming from your limbs, your upper limbs, that is, we have, what's going on in here? Let's see. Coming from, in my mind, there was went way smoother. But coming from your vein, from your upper limbs, we have the, let's just do this part, the subclavian artery. Okay? And this is nothing new for you, right? Subclavian artery. So let's try to follow this. So we have two veins. I said arteries, veins, okay? We have two subclavian veins, right and left, and you know they're located right next to the subclavian artery, okay? So you know pretty much its location, even though my super beautiful painting is not telling you that now. So, but you know that if subclavian artery are supplying or irrigating your upper limbs, well, we can deduce that the subclavian veins are draining your upper limbs, okay? So subclavian veins coming from the upper limbs. From your head and neck, they're coming to jugular veins. Now, both the subclavian vein and the jugular vein carrying blood in this direction, well, they merge together to form the right side and the left side brachiocephalic veins. And both brachiocephalic veins merge together to form the superior vena cava, which opens in the right atrium of the heart. Okay, so sorry about all of that technical difficulties in this, but let's see this veins. Now that we understand pretty much how they're formed, hopefully you don't get overwhelmed with all of this bunch of veins in here. Okay, so in here we have a lateral view of several veins that actually on the brain we don't call them vein, we call them sinuses. And I hope you remember they're formed by the dural sinuses at the dura mater, which leaves some empty spaces that are aligned with the endothelium and the blood is running through. So it acts as a vein, but it doesn't have the regular structure of any other vein. The thing is that these dural sinuses are collecting deoxygenated blood for most of your the entire brain, mostly the entire brain, and it empties the all of these deoxygenated blood into the internal jugular vein. See, now we can see it here. There is a foramen in here, the jugular foramen, that allows the vein to pass from inside the cranium to the outside and descends. See, and at the same time is collecting some of the deoxygenated blood from the anterior and lateral aspect of your face. The thing is that here we can see the internal jugular vein. Let's see the subclavian. The subclavian is coming, we don't see it here, but in here is the arm, right? So it empties or is collecting deoxygenated blood from your upper limb. And the subclavian also receives blood from this vein. Well, if we have an internal jugular vein, guess what? We also have an external jugular vein. The internal jugular vein is located deep to your sternocleidomastoid muscle, okay? Just crossing superficially, we can see the external jugular vein, the one that when we screaming and we see, okay, that's the external jugular vein. And the external jugular vein is just collecting deoxygenated blood from part of the lateral but mostly posterior aspect of your the skin of your skull and the scalp, all the surface of your head in here, okay? So this is external, superficial blood. The thing is that this external jugular vein empties the blood into the subclavian vein, okay? So external jugular vein empties the blood into the subclavian. The subclavian plus the internal jugular vein, they merge right here together and form, well, we're on the right side, the right brachiocephalic vein. Same thing is going on in the other side. So the right and left brachiocephalic vein form the superior vena cava that opens into the right atrium. Now, we described how the head and neck, this is a very, superficial overview, but we know how the drain and head is drained. Now, let's see how the deoxygenated blood from the upper limbs is collected and emptied right here into the subclavian vein. That's what's next. See you.